Come in.
Hello,
Hi.
I'm Cressman. I'm your PA student for the day. What brings you in today?
So today, I came in because I've noticed a change in my moles.
Okay. Just real quick, can we verify what's your name?
My name is Nika Chanlieko.
Okay. And what's your date of birth?
March 1294.
Okay. And the time is 12:10.
Mm-hmm.
Okay. When did you notice the change in your moles?
About 2 months ago, I noticed
2
it.
months?
Yes. I noticed it, it got bigger and it has like a weird shape and border around it.
Okay.
So I just thought I'd come in.
Okay. Have you noticed anything that makes it better or worse?
I guess since it's the summer, when I got darker, it started changing color more noticeably.
Okay. And does anything help it feel better?
No.
No? Okay. And has it changed? Like, has it progressed any?
Well, within the 2 months, it did get bigger.
Okay. And have you ever had this before? Have you ever experienced it?
No, this is my first time experiencing it.
Okay. And how would you, like, does it provide any pain?
No, there's no pain right now.
Yeah.
It's just the change in color and size.
Okay. And where exactly are the moles?
Oh, it's on my forearm.
On your forearm,
Mhm.
okay.
Right forearm.
Okay. And you said there's no pain?
No pain.
So there's no radiation anywhere?
No radiation. It hasn't spread. It's just one mole that got bigger. So I'm just a little concerned.
Okay. And did you notice this sudden? Did you notice that the mole grew suddenly? Did it grow?
Yes,
Right.
yeah. Within like 2 months, I noticed it more and more because it got bigger. So it was more noticeable than when it was smaller.
Okay. And have you noticed any other symptoms associated with it?
No,
No? Okay.
no other symptoms.
Okay. Since you said that you noticed a change in your moles, we're going to touch on the skin of the ROS.
Yeah, no problem.
Have you noticed any rashes?
No,
Any lumps?
no.
Sores?
I guess when I scratch the mole, it might start like getting some sores from like bleeding, but that's about it.
Okay, so there's itching.
There's itching, yes.
Okay. Any dryness?
No,
No. Any change in skin color?
just that mole.
Just the mole?
Mm-hmm.
Okay. Any changes in your hair or nails?
No.
And you said that you had a change in mole size,
Yes,
and it's gotten darker.
it's gotten darker.
Okay. Okay. Oops. Okay. Okay. Now we're going to move on to the pertinent past medical history. Have you ever had an MI?
No,
Okay. Have you ever noticed any moles like this before? Okay. 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 Has anybody in your family ever had moles like this?
my grandfather had skin cancer.
Okay. What side was that?
It's on my father's side.
Okay. And do you spend a lot of time out in the sun?
Yes.
Yes. Okay. Do you smoke, drink? Do you do any recreational drugs? Any prescription drugs?
Just birth control.
Birth control? Okay. Are you on any other medications?
No, just like vitamins.
Vitamins? What vitamins?
Vitamin C and B12.
C and B12? Okay. Do you take any herbal supplements?
No.
Home remedies?
No.
No borrowed medications?
Mm-mm.
Okay, any over-the-counter like Benadryl, Tylenol?
Benadryl sometimes when I have an allergic reaction to shellfish.
I say an allergy to shellfish.
Yes.
Stumbling over my words.
No problem.
And how often do you take the birth control?
Once a day.
Once a day? Orally?
Orally.
Okay. Do you have any other allergies besides shellfish?
No.
No allergies to medications? Any other animals?
No.
Insects?
No.
Environment?
No.
Okay. And what kind of reaction do you get with the shellfish?
So my lips get swollen. It's
Okay.
more contact rather than throat closing up.
Okay.
So I get patchy, red patchiness,
Okay.
and that's about it.
Okay. Okay. Since it's your first visit, we're going to go through your whole history.
Mm-hmm.
This might take a little while. Sorry about that.
It's okay.
Okay, we're going to tackle your childhood illnesses.
Okay.
Have you ever had measles,
No.
mumps,
Nope.
chickenpox,
No.
rheumatic fever,
Nope.
scarlet fever,
Nope.
polio,
No.
any other chronic illnesses,
No.
any psychiatric disorders?
No.
Have you gotten your immunization for polio,
Yes.
MMR,
Yes.
influenza,
Yes.
tetanus,
Mm-hmm.
diphtheria,
Mm-hmm.
pertussis,
Yes.
rotavirus, hepatitis B,
Mm-hmm.
chickenpox?
Yep.
Pneumococcal?
Yep.
I'm going to touch on your adult illnesses. Have you ever had thyroid disease?
No.
Any heart disease?
Nope.
Coronary artery disease?
Nope.
And you said you had no myocardial infarction?
No.
No angina?
Nope.
Hypertension?
No.
Hyperlipidemia? Diabetes? COPD? Asthma?
No.
Cancer?
No.
HIV?
No.
Hepatitis?
No.
Any kidney disease?
No.
Blood clots?
No.
Any psychiatric history, like depression or anxiety? Okay. Have you ever had any accidents or injuries?
I twisted my ankle when I was in college
Okay. And how long ago was that?
2 years ago.
2 years ago? Okay. Have you ever been hospitalized?
No, I just went to the ER.
Just to the ER?
Yeah.
Any surgeries?
No surgeries.
No surgeries, okay.
Well, if you count, I got my wisdom tooth taken out, if that's a
Okay.
surgery.
Okay. Now we're going to touch on your health maintenance.
Mhm.
Have you received your adult immunizations
Yes.
for tetanus,
Yes.
pertussis,
Yes.
diphtheria, polio?
Yep.
Measles, mumps, rubella,
Yes, for all three.
influenza,
Mm-hmm.
varicella,
Yes.
hepatitis B?
Yep.
The flu,
Mm-hmm.
influenza, pneumococcal,
Mm-hmm.
meningococcal,
Yes.
HPV,
Yes.
herpes zoster.
Mm-hmm.
Okay. Have you, how old did you say you were?
I'm 25.
25, okay, so you're probably a little young for mammograms. Have you ever had a colonoscopy?
No.
No? Pap smear?
Yes.
DEXA scan?
No.
Tuberculosis test?
Yes.
Yes.
My PPD comes back positive because I had the immunization when I was younger.
Okay.
And but my chest X-ray always comes back negative, and I got a chest X-ray about 6 months ago.
Okay. Any cholesterol?
No.
Any blood in your stool?
No.
Any lung cancer screening?
No.
TB testing?
No.
Oh, there's some good.
Yeah.
I'm going to touch on the women's health history. Might be a little awkward, but we got to get through it.
No problem.
How's your menstrual history been?
It's been pretty normal.
Pretty good? Okay. How old were you when you had your first period?
15.
15, okay. And your menstrual cycle is normal?
Yes.
Normal flow?
Mm-hmm.
How long does it usually last?
About 3 to 4 days.
3 to 4 days? And how long ago was your last period?
About 2 weeks ago.
About 2 weeks ago, okay. You're not at menopausal age yet. When was your last pap smear?
6 months ago.
6 months, and it came back normal?
Yes.
Okay, that's good. Do you have any history of STIs?
No.
No. And you said you take birth control?
Yes.
How long have you been on birth control?
Since I was 18,
18?
so
Okay.
about 7 years now.
7 years, okay. Have you ever been pregnant?
No.
No miscarriages?
Nope.
Okay. No abortions? Okay. We're gonna move on to the family history.
Mm-hmm.
Did your mother or father suffer from any headaches?
Just the occasional normal headache
okay.
from stress.
Okay. Any seizures?
No.
Stroke?
No.
No illness?
Nope.
Suicide? Substance abuse?
No.
Thyroid disease?
No.
Coronary artery disease?
No.
Hypertension?
No.
Elevated cholesterol?
No.
Diabetes?
No.
Asthma or lung disease?
No, but my dad smokes.
Okay. Tuberculosis?
Mm-mm.
Renal disease?
I'm sorry, what?
Re-
Renal disease? No.
Yep, yes, renal. Arthritis?
No.
And you said you had allergies to shellfish.
Yes.
I mean, wait, did your family have allergies?
Oh, my dad didn't have any allergies.
Okay. Mother?
No allergies, my dad.
No, okay. And have either of your mother or father experienced like the moles?
No.
No? Okay. Have they had any history of cancer?
Yes, my dad had liver cancer.
Liver?
He passed away when he was 42.
Okay. And your mother?
My mother's still living. She doesn't have any major diseases.
Okay. And any history of genetically transmitted diseases?
No.
No? Okay. Did your paternal grandparents have any headaches?
No. Just occasional ones.
Okay. Seizures?
No.
Stroke?
No.
Mental illness?
No.
Suicide?
Mm-mm.
Substance abuse? Thyroid disease? Coronary artery disease? Hypertension?
Yeah, he has hypertension. My
Um,
granddad, and my dad's side.
Okay. Elevated cholesterol?
Yes.
Yes,
Mhm.
for both of them? Or?
Just my grandfather.
Okay. Any diabetes?
My grandma.
Okay.
And my dad's side, yeah.
Any asthma or lung disease?
My granddad and my dad's side had lung cancer. He
Okay.
died when he was 65.
65, okay. Tuberculosis?
No.
Renal disease?
No.
Arthritis?
My grandma.
Grandma? Okay. Did either of your paternal grandparents have allergies?
Not that I know of.
Did either of them have any moles?
My grandfather did.
Okay. Did any history of cancers? You said your grandfather died of lung cancer?
Yes.
Okay.
And my grandfather had lung cancer as well.
Okay. Any genetically transmitted diseases? Okay. Almost there. Do you have any siblings?
I have one sister.
One sister, okay. Any headaches?
No.
Seizures? Stroke? Mental illness?
No.
Suicide?
No.
Substance abuse?
No.
Thyroid disease? Coronary artery disease?
Mm-mm.
Hypertension?
No.
Elevated cholesterol? Diabetes? Asthma or lung diseases? No. Tuberculosis?
No.
Renal disease?
No.
Arthritis? Allergies? Did your sister have any moles?
She has a couple moles, but she got it checked out and it's pretty normal.
Okay. Any cancer?
No cancer for
No
her.
cancer? And no genetically transmitted diseases?
No.
Okay. You've never been pregnant, so you don't have any kids.
Mm-hmm.
Friends or maternal grandparents. Have either of your maternal grandparents had headaches?
Occasional.
Occasional? Seizures or strokes?
No.
Mental illness or suicide? Substance abuse?
Nope.
Thyroid disease?
No.
Coronary artery disease?
No.
Hypertension?
No.
Elevated cholesterol?
Yes, both.
Both? Okay. Definitely gotta keep an eye on that for you.
Mhm.
Diabetes?
Just my grandfather.
Grandfather? Okay. Asthma or lung disease?
No.
No. Tuberculosis?
No.
Renal disease?
No.
Arthritis?
My grandma.
Grandma? Okay. So both grandmothers. Allergies?
Not that I know of.
No. Did either of them have any moles?
No.
No. Any history of cancer?
No. No, not on my mom's side.
Okay. Genetically transmitted diseases?
Nope.
Okay. Okay, we're gonna go into your social history.
Okay.
Where were you born?
I was born in the Philippines.
Philippines? Okay.
Mhm.
And how was your childhood?
It was good. I spent my early childhood in the Philippines and my teenage years here in America.
Okay. When did you come to the U.S.?
When I was 11.
11? Okay. What was your last year of schooling?
I'm on my master's right now, so undergrad will be the last,
Okay.
the degree that I got.
Okay,
My
sounds
bachelor's.
good. What's your occupation history?
I work as a cashier in ShopRite when I was in high school, and then when I was in undergrad, I worked for a catering service in school.
Oh, nice.
Yeah, and then for my gap year, I worked in an ER in North Jersey
Okay.
as a mental health center.
Okay. In your house, do you have any stairs?
Yes.
Yes. How many?
About 15 as the main stairs,
15.
and then maybe 5 outside.
Okay. And who lives with you?
I live with my mom,
Mom?
my grandma, and my sister.
Sister. And which grandmother?
Father's side.
Okay. And do you feel safe at home?
Yes, I do.
Do you have any pets?
No pets.
No pets. And do you have transportation?
Yeah, we use a car.
Use a car? Okay. Do you use your seatbelt?
Yes.
Okay, good. Are you married? Do you have a boyfriend, girlfriend?
Boyfriend.
Boyfriend, okay. Have you had any recent stress?
Just school in general.
Just school?
Mhm.
Any long-term stress?
Nah.
No? Okay. Have you served in the military?
No.
No. And how's your financial situation?
It's pretty good. My parents are helping me with school.
That's good. And do you do anything for fun? Any leisure activities?
I watch movies, hang out with my friends.
Okay.
So I've been trying to fit that in school.
That's good. Do you exercise?
Try to.
Try to?
Try to.
Don't we all?
Yeah. It depends on the week and how much work I have to get done.
Yeah. Yeah, makes sense.
Mhm.
I'm going to go into the activities of daily living.
Okay.
Are you able to bathe yourself?
Yes.
Dressing yourself?
Mhm.
Go to the bathroom yourself?
Yep.
Be able to sit up, stand,
Mhm.
lay down? Okay. Are you able to hold your bladder?
Yes.
Okay. Are you able to feed yourself? Are you able to use the telephone?
Yes.
Go shopping?
Mhm.
Are you able to prepare food?
Yeah.
Housekeeping?
Mhm.
Laundry?
Yes.
Do you drive yourself? Transportation?
Yes, I can drive myself.
Okay. Take your medication?
Yep.
Manage your money?
Mhm.
Okay. We're going to touch on your religion. What religion are you?
Catholic.
Catholic? Are you, okay. You said you exercise. What type of exercise do you usually do?
I usually do cardio and some targeted workout.
Okay,
Once in, maybe 3 times a week.
that's good. What's your daily caloric intake?
It's pretty normal. I eat 3 times a day.
That's good.
Try to fit in some veggies and vegetables every now and then.
Okay.
Mm-hmm.
Do you drink enough water?
Try to, yeah.
Okay. Do you consume a lot of caffeine?
Just chocolate, no
Just
tea or
chocolate.
coffee.
No coffee, no tea,
No,
no soda?
no soda.
Okay. And how would you describe your sleep?
Pretty normal. On a usual basis, I get 7 when I have a lot of work and exams.
Okay.
Maybe about 5 hours.
Okay.
Mm-hmm.
Do you ride a bike?
No,
Okay. Do you use sunblock?
no,
No?
no.
Okay. Do you have smoke detectors in your home?
Yes,
Okay, that's good. Do you have locked cabinets for medications or chemicals?
no. I need to work on getting one.
Okay. This might be a little awkward, but we're gonna touch on the sexual orientation and practices.
Mm-hmm.
How many partners have you had?
I've had 2.
2? Okay. Do you practice safe sex, condoms?
Yes.
Okay. And you said you take birth control?
Mm-hmm.
Any history of STIs? No? Okay, that's good. Do you do any alternative healthcare practices?
No.
Meditation?
Meditation once in a while.
Yoga?
I've tried yoga a couple times in the past
Okay.
month.
Chiropractors?
No.
Herbal supplements? No. Okay. You haven't had any violence from your partner?
No.
Okay, happy to hear that.
Mm-hmm.
Do you smoke?
No.
Have you ever smoked?
No.
No? Okay. That's good. Okay. Do you drink
Once in a while.
once in a while? How often is once in a while?
Maybe twice a month.
Twice a month?
Yeah.
And how much do you drink during that time?
Maybe like 4 glasses of wine.
Okay. Okay. And how big are the glasses? Like
Like 6 ounce.
6 ounce? Okay.
Yeah, 6 ounce.
Okay, because I've seen those glasses where it's a whole 1 bottle of wine glass.
Yeah, I know what you're talking about.
You don't do any recreational drugs? Okay, any non-prescribed medications for you? Okay. Okay. This might be the longest part. We're going to go over the review of symptoms. That's all right.
Mm-hmm.
Okay. I'm going to start at the head. Have you noticed any unusual weight gain?
No.
What's your usual weight?
My usual weight is around 100 pounds.
100?
Mm-hmm.
Okay. Have your clothes felt any looser or tighter?
Not lately.
Not lately. Have you felt any weakness or fatigue?
No.
Fever? Okay. To the skin. We're going to do the head now. Have you ever had any headaches?
Just your usual stress-related headaches once in a while.
Okay. Any head injuries?
No.
Dizziness?
No.
Lightheadedness?
No.
We're going to touch on the vision.
Okay.
How is your vision?
I have to wear glasses to see far away.
Okay. What's your prescription?
Negative 2.5 on both eyes.
Okay. And when was your last eye exam?
4 months ago?
4 months ago? Okay. Do you have any pain or redness in your eyes? No? Okay, that's good. Any excessive tearing? Double vision?
Nope.
Blurred vision?
No.
Do you have any spots or specks?
I wear glasses.
No
Oh,
spots.
specs?
Specs.
Oh, no. I was like, I thought you were talking about you wear specs. Yes, I do.
Yeah, specs, not spectacles. Do you have any sensitivity to flashing lights?
Nope.
Do you see any flashing lights? No. Do you have any glaucoma or cataracts?
No.
No. Okay, we're going to go into the ears now. How is your hearing?
It's been good.
Okay. Any tinnitus or vertigo?
No.
Earaches? Infection?
Mm-mm.
Do you have any discharge?
Nope.
Have you noticed your hearing decreased?
No.
No hearing aids? Okay. How's your... Now we're going to touch the nose and sinuses. Do you have frequent colds?
No.
Any discharge? Itchiness? Stuffiness? Hay fever? Nosebleeds? Sinus trouble? Okay, now the throat. How are your teeth and gums?
They've been pretty good. I haven't noticed any problems
Okay.
lately.
Any bleeding?
Nope.
Dentures?
No.
Last dental exam?
A year ago.
A year ago? Okay, so you might be in her next checkup. Sore tongue? Dry mouth? Frequent sore throat?
No.
Any hoarseness?
No.
Have you noticed any swollen glands in your neck?
Not that I noticed.
Any goiters?
No.
Bumps?
No.
Any pain or stiffness? No. Okay. For your breast, have you noticed any lumps or pain?
No.
Discomfort? Nipple discharge? Do you examine your breast? Okay. That might be good in the future. I think we just hit the time.
That's it?
Yep.
Awesome.
That's good. I will get this back
Thank
to you.
Thank you.
Thank you.